Hi everyone, I'm Dr. Bishr, and this is my business partner and co-dermatologist.
Hi, I'm Dr. Sarah Ferrer-Bruker.
And we're in St. Augustine, Florida at Bold City Dermatology.
We hope to be your favorite dermatologists.
Today we're going to talk about the 5 spots of concern that you see the dermatologist for, but they're completely benign.
I love to deliver good news, and luckily I get to every day, but people come in pretty concerned, usually about a little brown spot that's raised. I like to call these birthday presents. Dr. Bishr has one right here. Sometimes they're flat, sometimes they're raised, and they are called
Seborrheic keratosis or wisdom spots. I probably do have a couple because I just had a birthday.
You must be getting wise.
I am very wise. These are raised, warty, velvety, what we call plaques sometimes, or papules. They are small, as papules and plaques are when they're flat and kind of bigger. And they can happen anywhere on the body.
They can pop out of nowhere.
Usually they start, I'd say, in your 40s and 50s.
I tell people it just means you're past the age of 30.
Exactly, which I'm getting there.
You're plenty there.
Those are the benign brown spots, sometimes skin color spots that people see us for. And we'd love to deliver this news. We see it, it's a clinical diagnosis. We don't have to biopsy it or do any additional testing, and you'll probably just continue to develop more of these. There's a genetic component, and sometimes they are due to sun exposure or excessive sun exposure, but genetics plays a huge role in those.
If they're irritated, we treat them. If you don't like them, we can cosmetically remove them.
Exactly, so that's one.
I would say the next most common thing people come in asking about are these little red bumps or moles, usually on your torso.
Called cherry angiomas.
I tell people that they are kisses from angels.
Causes for cherry angiomas.
I got a few after I've had kids. That's a very common thing.
And these we don't treat, we just leave alone unless they're in cosmetically sensitive areas and you want them removed. Or sometimes if they get nicked, if you're shaving or whatnot, they can bleed significantly, but they're benign and they're little red, bright red dots.
We see them every day, nothing to worry about.
That's 2. 3.
I get this all the time. People come in with a new hard bump, usually on their legs. And these are called dermatofibromas.
For DFs for short. So dermatofibroma is a little scar-like
I tell people that they are little scars shaped like moles, and they're actually one of my least favorite things to talk about with people because I don't really have a great offering on to how to treat them.
What do they look like?
They're little raised bumps, and it's more of a feel.
They kind of feel like pebbles or like little BBs under your skin, and if they're raised, they're firm and they're smooth most of the time.
They can be all sorts of colors, and it's usually from a bug bite.
Or shaving.
Or any sort of trauma. Trauma or bug bites.
That's 3, and then after that is lentigines or lentigos.
Acquired sunspots.
They're like these feathery, light brown, flat spots that you can get on your face. I see them on the shoulder and back all the time here in Florida because that's where people get sunburned all the time.
You can get them at a really young age and just collect them over time. They can change from time to time.
They darken when you're outside as well.
And occasionally they can evolve to a very superficial type of melanoma called lentigo malignum, which is why we encourage you to come in for a skin check.
Exactly. So the 5th one is?
Just a normal mole. To me, a mole is a growth. That could be anything, but we call them nevi.
And they're just the melanocytes proliferating, meaning a melanocyte is the pigment-producing cell, and there's a lot of them in that one spot, leading to that dark color. I'd say 99.9% of moles are benign, harmless, but there are some that start to look bad, and that's A.
They can be asymmetric, where you can't fold them from left to right or top to bottom, and the sides match.
B.
The border is not perfectly smooth. It is irregular, a little notched or regressed or growing a tail, just not perfectly smooth.
C.
C stands for color. You want your moles to be evenly pigmented.
Or if the color starts to disappear, that can also be a bad sign when all of a sudden the mole starts to disappear or you get a halo around it. So color. D's diameter, for any of you who still remember what a pencil eraser looks like, anything larger than a pencil eraser is not good.
That's right.
And
E just means any sort of evolution, which means change. So you can tell us that. We can maybe keep track of you over the years.
This is one of those other things that evolution is good, except in your moles. E. So A, asymmetry. B, border irregularity. C's color change. D's diameter. And E is evolution.
And that's just a classic tool to help you at home evaluate your moles.
All right, so let's go over our 5 spots of concern that are mainly benign. SKs, or seborrheic keratosis.
Birthday presents.
Exactly. Cherry angiomas.
Kisses from angels.
Dermatofibromas.
Scars shaped like moles.
Lentigines.
Acquired sunspots.
And moles.
Beauty marks.
Exactly.
Except for when they change.
With that, don't forget to like and subscribe. And if you're in the St. Augustine area, come say hi. Come drop by our clinic. If you need a skin check, we'll check your skin. We'll reassure you most likely. But if we need to treat you, we'll do that. Don't forget to like and subscribe and drop your comments below. Thanks for joining us.
Thanks.